Welcome to Birthing While Black, the deadly truth about medical racism. Imagine this. You're in a hospital in labor and you tell the doctor something feels wrong. But instead of getting immediate care, your concerns are dismissed. Hours later, you're fighting for your life. This is not a rare story. It is the reality of thousands of Black women in the United States. Black women are 3 times more likely to die from pregnancy-related complications than white women, according to McLemore 2021. But why? Today we'll explore the maternal mortality crisis through the lens of intersectionality, a concept coined by Black feminist Kimberly Crenshaw that helps us understand how racism, sexism, and class disparities collide in healthcare. It describes how different forms of oppression don't just exist separately, but overlap, creating unique disadvantages for people who exist at multiple marginalized identities. And that was Crenshaw in 1989. In this case, Black women experience both racial and gender discrimination, which amplifies their vulnerability in the healthcare setting. For example, sexism in medicine means that women's pain is often taken less seriously than men's. Racism means that Black patients' symptoms are often ignored or downplayed. When these biases intersect, the consequences can be and have been deadly. According to the CDC, around 817 women have died due to pregnancy-related causes in the United States, and Black women are disproportionately affected. According to Chin, Martin, and Redmond, racial disparities in maternal mortality are not due to biological differences, but are instead rooted in systemic inequalities within healthcare systems. Black women experience higher rates of severe complications like preeclampsia and hemorrhaging, yet their pain and symptoms are often dismissed by medical professionals, leading to preventable deaths. End quote by Albright and Bundor. Intersectionality helps us understand why Black maternal mortality rates are so high. Black women are not just dealing with racism in healthcare or just gender bias. They're experiencing both at the same time, along with economic barriers that make it harder to access quality care. So what makes medical professionals not believe Black women? A combination of factors. Other than the fact that women's health has never been much of a priority, Black women's health has been at the bottom of the pyramid. To further understand why Black women's pain is often ignored in medical settings today, we have to look at history, specifically the way genealogy was developed through the exploitation of enslaved Black women in the 19th century. One of the most infamous examples is J. Marion Sims, often called the father of modern genealogy. In the mid-1800s, Sims performed painful surgical experiments on enslaved Black women without anesthesia, consent, or proper medical care, because he believed that Black people did not feel pain the same way white people did. One of his most well-known subjects was Anarcha, an enslaved Black woman who endured over 30 experimental surgeries, as Sims attempted to perfect a technique for repairing vesico-vaginal fistulas. Sims later used this technique to successfully treat white women, but only after perfecting it through repeated, painful experiments of Black women. Sims and other white physicians viewed Black women as experimental subjects rather as patients deserving of humane treatment. Quote by Washington. These racist medical beliefs that Black women had a high pain tolerance or were quote-unquote stronger than white women did not end with slavery. They were passed down through generations of medical training, shaping how doctors today still underestimate Black women's pain. Studies show that medical students and professionals are less likely to prescribe pain medication to Black patients and more likely to assume that Black women are exaggerating their pain. This is actually something I've experienced firsthand while battling cancer. Male doctors often refuse to give me pain relief until I couldn't speak coherently from the amount of pain that I was in. Nurses advocating for me and advocating for my right to comfort and care were so detrimental to my physical and mental healing. A more popular case would be Serena Williams. Even wealthy, high-profile Black women are not immune to this crisis. After giving birth in 2017, Williams felt a blood clot in her lungs, a life-threatening condition that she had experienced before. But when she told the medical staff, they dismissed her concerns and delayed treatment. Chin Martin and Redman highlight this, saying, Williams' experience highlights how implicit bias affects even the most privileged Black women. When Black women's pain is doubted, it leads to delayed care and medical neglect. If this could happen to a world-famous, wealthy Black woman, what are the implications for less wealthy and quote-unquote less important Black women? Class also plays a role in this crisis. Many Black women rely on Medicaid, which covers 65% of Black maternal care. But Medicaid often ends just 60 days postpartum, leaving women without critical follow-up care. According to Salami, Walker, and Campbell, Black women are more likely to live in areas with hospital closures, fewer specialists, and inadequate access to maternal health care, making early intervention difficult. Policies that limit access to affordable health care put Black women at an even greater risk. This is why some activists argue that Black maternal mortality is not just a medical issue, it is a political issue as well. Despite these challenges, there are people working to change the system. The Black Maternal Health Caucus has introduced the Momnibus Act, which includes measures like expanding Medicaid coverage and funding community-based programs for Black mothers, Salami, Walker, and Campbell. According to Macklemore, community-led initiatives such as doulas and midwives have been shown to improve maternal health outcomes for Black women as well by providing culturally competent care. Groups like Sisters in Birth and Black Mamas Matters Alliance are also stepping up to support Black mothers and demand change. The Black maternal mortality crisis isn't just about health. It's about racism, gender inequality, and political failures. Intersectionality helps us understand that these systems work together, and until we address them all, the crisis will persist. So I am calling the listeners to support organizations that fight for Black maternal health, push for policies like the Momnibus Act, and most importantly, believe Black women when they speak on their experiences and advocate for their health. As always, thanks for listening. And today is the 5-year anniversary of Breonna Taylor's death, so say her name. Thank you.